a brief intro. So Ms. Rachel Davis is works at the ACS, at the American Cancer Society, and she leads the cancer control goals arm of the ACS for New Mexico. She serves as the implementation lead for specific pillar priorities with cancer centers, and she also manages priority accounts. And one of the things that she does is she engages partners through convening and implementing evidence-based strategies through best practices and cultivating relationships. And so I'm going to hand it over to her to go ahead and present. Thanks so much, Rachel, for being here.
Thank you so much for the introduction. Can you all hear me? Okay. Yes. Amazing. Thank you guys for taking the time to show up on your lunch hour. I'm going to be providing you guys today with PowerPoint and some information and education around the American Cancer Society's New Mexico programs and our overview. Let's see. There we go. All right, so we're starting out here just with some basic cancer facts that's fairly important for everyone to know. We know that 2 million plus new cancer cases are projected to happen in 2024. And in all cancer deaths in people under 50, colorectal cancer is now #1 in men and #2 in women. And also, 4 screenable cancers are on the rise: breast, prostate, colorectal, and cervical cancer. I'm not sure if you all know, but we are currently doing a echo intervention when it comes to colorectal cancer in partnership with the University of New Mexico Health Sciences Center. And so these are some of those statistics that we look at when we're trying to really do those early-based interventions. This is a slide that will show some cancer statistics for 2024, an estimated number of new cases across the US. And you can see in males, the estimated new cases, the highest are prostate, lung and bronchus, colon and rectum, followed by urinary cancer. And in women, breast, lung and bronchus, colon and rectum, followed by uterine cancer. So when we take a look, and this is a snippet, the ACS has a cancer statistics center. So if any of you guys ever want to visit that site to pull any of this data, it's available to you. So here we're looking at estimated new number of cancer deaths in the US in 2024. And you can see that it's similar, but a little bit different. For males, it's lung and bronchus, prostate, colon and rectum cancer. And in females, lung and bronchus, pancreas, and breast cancer. And you'll see here in the next slide, we break those numbers down a little bit, and we're looking at New Mexico specifically. So in New Mexico, in 2024, there will be 11,220 new cancer cases throughout our state. That means that there's approximately 54 new cases of cancer every day in our state. And of those cancer cases, there will be 3,890 cancer deaths. And that means approximately 18 deaths every day. So what do we do with this data, and why do we present this data? Again, so that we can early intervene with prevention and screening and hopefully have impact to lower these numbers. You can see here the breakdown specifically for New Mexico is a little bit different than nationwide. For females, you can see in this year alone, there'll be 1,780 breast cancer diagnoses. For prostate, in males, it'll be 1,370. But when you look at both sides, you'll notice that the colorectal cancer has risen. And look at the death rate to colorectal cancer. And that's because we know that colorectal cancer is on the rise in lower aged patients. And so that's why the American Cancer Society has dropped that screening age around colorectal cancer to age 45. So cancer is a disease that doesn't affect everyone equally. We know that our various communities have different representation, and some of these cancers have higher death rates. For example, in our African American community areas, and the breast cancer mortality rate for African American women is higher versus white women. And the ACS is recently doing a study around this called Voices, and we're enrolling several hundred women, Black women, to join this study so that we can get a deeper understanding as to why that's occurring and see how ACS can interact with the communities to be able to prevent and do some early based interventions. The Voices study, once it comes to New Mexico, I'll reach out to a lot of you that are on this call because we'll be recruiting members. 80% of outcomes are also dictated by social determinants of health. I think we're all really aware of this, including economic stability, education, access and quality, social and community contexts, neighborhood and built environments, as well as healthcare access and quality. So why do we want to start our conversations around cancer screening? Well, we know that we have the power in our organizations to really promote cancer screening to have impact on the numbers that I showed you all at the beginning of the slide. These are just some really good quotes on how we as providers, family members, co-workers can actually talk about cancer screening and some really great cancer screening conversation starters. So we suggest, really bringing it down to the level of how we care about people, right? How we care about our neighbors and how we care about our community. I care about your health. Are you getting regular cancer screening tests? Did you know there are tests that can catch changes in your body before they become cancer? So some of these ways of being able to talk about cancer screening at the very beginning with our practitioners really seem to help increase our community's commitment to wanting to go in and get those screenings completed. Also, we have our cancer screening website here, cancer.org/get-screened. And this provides a lot of cancer screening FAQs, including information about how to schedule screening tests, how to afford screening tests with or without insurance, and more. And so this is a really great resource for our community members. I believe there's also area where you can actually search the closest screening centers via zip code in this website. So cancer screening guidelines. Cancer screening saves lives, and cancer screening recommendations are for people of average risk of certain cancers, and the ability to talk to doctors about which tests might you need and the screening schedule that's right for you. It's good to make sure that we have patients that are talking to our physicians about risk factors, such as lifestyle behaviors, family history that may put loved ones at higher risk. So here's a little bit of a breakdown where we can see that between ages 25 and 39, women should start receiving their cervical cancer screening. And this is recommended for people with the cervix beginning at age 25. When we move to ages 40 to 49, you can see that a lot more screening tests are recommended. Breast cancer screening is recommended beginning at the age of 45. However, recently, the task force has recommended breast cancer screening to begin at age 40. For the same reason, they're seeing that the rate of cancer in breast cancer screening is coming about at lower ages. So at age 40, you can start talking with your doctor to see whether or not breast cancer screening is right for you. Again, cervical cancer screening should continue, and colorectal cancer screening is recommended for everyone started at age 45. At age 45, African American population should discuss prostate cancer screening with a doctor because there's much higher risk for prostate cancer in our African American population. Ages 50 and above, many cancer screenings are recommended: breast cancer screening, cervical cancer screening, our colorectal cancer screening. And this is when patients should start talking to their physicians about lung cancer screening if they have a history of smoking or if they currently smoke. And discussing prostate cancer screening with doctor is recommended during this age range throughout all men population. So we're breaking down our recommendations for lung cancer screening. The American Cancer Society recommends yearly screening for lung cancer for people with a smoking history. Here is the screening eligibility. You can see adults age 50 to 80 years old, any patient or community member that currently smokes or used to smoke, and or have a history of 20 or more packs a year history, even if they recently quit. Before getting screened, they should have a discussion with their healthcare provider and kind of talk about the benefits, limitations, and risk of low-dose CT scanning, which of course is the American Cancer Society's recommendation for lung cancer screening. People who currently smoke should receive smoking cessation treatment. And then again, here's the listed resource for anybody who wants to gain more information or access resources that ACS provides, including pamphlets or booklets on prevention and cessation that can be provided to patients. I'm not sure if you all have seen this, maybe you have, but I worked on a campaign here directly in New Mexico. And this is our I Love You Get Screened campaign. Cancer screening saves lives. And this is where I was talking to you about where you can utilize this QR code up at the top, or when you go to the website, you can see this little address zip code entry point. And this can be a screening locator device for all organizations to be able to check and see and/or patients where they can get screened. We also have a 24/7 cancer hotline, and that hotline can also help any patient or any person calling that wants to receive information on local screening areas. And so this is a pretty nice tool that we just placed into the website this year. How ACS helps. So this is a little bit more about our programmatic work and bringing about like knowledge and information on what ACS actually does. So we are currently the only organization that supports people with cancer at every step of the journey, from prevention all the way to survivorship. We offer patient support. We're also built to do advocacy through our 501c3b arm, and that's the American Cancer Society's Cancer Action Network that works locally, legislatively, and also through the legislative sessions in Washington, D.C. We also advance discovery, and so we're highly known for providing grants to researchers to really study and bring about new discoveries when it comes to cancer treatment and cancer care. So together we can end cancer as we know it for everyone is ACS's really thought behind this tagline. What we know is that we want to bring health equity into our organization, and that means that we want to end cancer as we know it for everyone, wherever you are, from whatever community you serve in. So ACS funds breakthrough research, and which provides better treatments and can uncover factors that may cause cancer and improve the quality of life of people facing cancer, as well as reducing cancer deaths. We also do that through our early-based intervention work, which I do here in New Mexico. We advocate for building healthier communities, creating safer workplaces, and providing greater and more equitable access to quality medical care. And we provide day-to-day patient support through our patient programming that provides access to care via lodging, transportation, and our 24/7 helpline. How ACS works with our community partners. So ACS provides quality improvement by creating learning collaboratives, by performing evidence-based informed strategies, such as the example of the ECHO. We help educate providers, and we provide tools and resources on best practices, and have these kits available to our providers, one through our website. And if you reach out to me locally, any information that you may need, we can request and get to support. We support navigators and navigation. UNM Comprehensive Cancer Center was actually one of the recipients of the American Cancer Society's navigation grant opportunities. That was a $300,000 grant under the name of MONOS. And so some of these are the ways that we support local organizations. We support navigators in cancer information and support, symptom management resources, nutrition and cancer, as well as transportation and lodging. And I'm sure you all are aware of our recent Patient Navigation Lion program, which is a online credentialing program for navigators. We convene partners to solve barriers, like we partnership with American CC, AR roundtables, and all of the national roundtables that sit in Washington, D.C. Again, we have a wealth of information for healthcare providers covering all of these various topics: lung cancer screening and our shared decision-making kits, colorectal cancer screening and the various testing options. We provide information around FIT testing, Cologuard testing, colorectal cancer screening via colonoscope, all of various breast cancer screenings, cervical cancer screening, and our HPV vaccination work. We want to empower healthcare providers to have the necessary conversations with patients to recommend screening of asymptomatic individuals according to the recommended guidelines. So cancer prevention and early detection. We utilize evidence-based and evidence-informed resources and information to recommend effective strategies to increase cancer screening rates. And these effective strategies include information such as client reminders. We may work with institutions that we can work with their EMR or their patient portals to provide client reminders to patients. We work to reduce structural barriers, including cancer treatment. So we have our Road to Recovery program that assists patients in getting to and from cancer treatment appointments. We provide transportation and lodging grants to local sites within New Mexico. And we also provide assessment and feedback from our provider networks, as well as, like today, providing professional education. So back to the ACS cancer screening and our cancer and prevention, you see the screenings that we highlight here, but you're also looking at some of the really awesome images for our ACS Get Screened campaign. So these are various visuals that highlight the importance of screening and why folks should get screened. And recently here, alongside the Colorectal Cancer ECHO, we were able to provide funding for these ACS Get Screened, I Love You Get Screened campaign to be presented both in English and Spanish on our local buses that run throughout the city of Albuquerque. So this is really cool, and like one of those other ways that we are really wanting to spread awareness and spread that message to our community members. So here are some funded institutions. You can see we have funding in New Mexico. That's not necessarily where, but this is predominantly around UNM Comprehensive Cancer Center, UNM Research Center, and we've also funded several institutions throughout New Mexico. We try to focus also on our rural areas. And so COPE has recently received a grant for food as medicine, which is really exciting. And also all of our various transportation and lodging grants throughout the state. So a little bit about the American Cancer Society's Cancer Action Network. I'm actually wearing one of their t-shirts today. And right now, this minute, our American Cancer Society Action Network is in Washington, D.C. There is approximately 750 community members that are voicing ACS's advocacy when it comes to cancer care in Washington, which is super awesome. We have local community members throughout New Mexico that are actually there today. Very exciting. They're doing a big ceremony called the Lights of Hope, where they've taken our tradition of lighting bags, our Luminati-S, and they have placed cancer patients' names and advocacy efforts on these Luminati-S, and they've lit them up all around the Washington, D.C. Pool. So it's a very beautiful sight. And they're talking to all of the legislators around Washington about continuous funding for cancer care, cancer research, and the importance of why this funding needs to continue.
Okay, looks like we had some technical issues and we'll see if Rachel will be able to pop back on. Let's just hang tight.
Hey, Dolores, I have a question.
Sure.
Good morning, everybody. I'm wondering if anybody knows about the example that Rachel just provided with reaching out to patients through EHR, EMR interfaces, and whether or not anybody knows of those projects going on in our state.
That's a great question. I don't. Does anybody who's on the call know that?
Then I will ask it when we find Rachel
Okay.
back on our screen. Thanks.
All right, there she is.
I
Hi.
apologize. I have no idea what happened. I got kicked out of the meeting.
That's all right.
But we are living in the Zoom universe, and so that happens.
Absolutely.
Yeah, glad I could get back in. I'm going to go ahead and share my screen again. We were talking about our availability of information for folks that might want to visit some of these websites to get information on various journals and this Cancer Facts and Figures link. And if you guys want to, I can share this presentation with you. Will take you directly to uh, um, the Cancer Facts and Figures. Doesn't seem to want to share.
Yeah. So, there you go. Okay. Oh, there you go. Every time I start talking. Okay. And you're muted again, Rachel.
I don't know what's happening here. I can share, but it's not moving the slides forward. In Zoom. So
Yeah.
let me try one more thing.
Okay.
Yeah, I don't know. You
Yeah, we can see that.
can see this over here.
Mhm.
Are you seeing the education for healthcare providers or education websites?
The education for healthcare providers.
Okay. Not. So sorry. I don't know.
If you want, I mean, I know the visuals are super helpful when we're giving presentations, but if you'd like to just talk it through, we can send the slides around. We can also support that way. So just let us know.
Okay, I'm so sorry. I
That's
don't know what's
okay. I
happening.
know.
I don't know why it's not sharing. All right, so I'll just continue going. So without looking, you can see that we have our cancer.org website, and that provides lots of information for professionals. On our cancer.org website, we have fact sheets, and these are single page front and back PDF flyers that kind of talk about the latest figures and trends for common cancers and are something that can be housed like to provide to physicians and or patients. ACS also offers several free continuing education, talking about things like nutrition, physical activity, survivorship, HPV posters. Like if you'd like to have HPV posters, we can order those for any organization so that we can get those into our pediatric clinics to really remind physicians and people that show up in the pediatric clinics that HPV vaccination should start at age 9. And it really presents HPV vaccination as a cancer preventative versus talking about it as like some sort of STD or, you know, sexual through our portal. And these are education materials that can be ordered through cancer.org/materials. And these are things that are like little booklets on palliative care, managing cancer pain, thinking about after diagnosis. They explain a little bit about chemotherapy, radiation therapy. And so those booklets oftentimes can be very useful in cancer clinics. And then, of course, our resources for our patients. This is really awesome. ACS this year just came out with an app, and it's called ACS Cares. So the CARE stands for Community Access to Resources, Education, and Support. So this app actually equips patients facing cancer with curated content and programs and services that fit their specific cancer journey or their specific cancer diagnosis. And so what's super cool about this app is a patient can register and they can put in their particular diagnosis, whether it's breast cancer, a specific type of breast cancer, colorectal cancer. And then once they actually finish with their login, everything that ACS has, like within the website, will pull into their portal around that specific cancer. Super cool. Within the app, patients are also able to join into chats with other patients that may be going through the same cancer journey that they are. So they can talk to other patients about, you know, what treatments they have gone through. They can get support from patients and other community members. They can access that information, and this app can really provide patients with customized guidance and also that support system that's available. So we love this. Really something that we feel that we should get out, and you guys can talk to your patients about ACS Cares and the app. It's really, really an awesome tool, and it's right at a patient's fingertips. Recently, I have a cousin that was diagnosed with colorectal cancer at the age of 50 and did not get screened at age 45. And this is something that I shared with him, and he thought it was just super awesome. So really wanted to bring that to your all's attention. Also, we have our National Cancer Information Center. So ACS provides a 24-hour, 7-day-a-week helpline to guide anyone through their cancer experiences. All of the folks that answer these phone calls are cancer information specialists, and they're able to assist in various languages, English, Spanish, and 200 other languages via ACS's translation services. And these folks can answer questions about a diagnosis, identify community resources for patients, provide information on clinical trials, programs, services available through our website or our 1-800 number, which is 1-800-227-2345. And these folks are awesome. Like when patients have recently been diagnosed and, you know, they're feeling sad or upset, they're trained to work these patients through some of those items that they might be experiencing at this hard time in their lives. And so that 1-800 number is really essential and important and can be passed on to any patient that's diagnosed with cancer. We also have a video chat line where, you know, provides the same sort of services, but it's via chat instead of a phone call. And that website is cancer.org/video chat. And our community members and patients can connect with someone via video if they also would like. So that's really awesome as well. On our cancer.org website, you can see that we have our website broken down into various topics. We have survivorship topics, so that's information to support treatment and survivorship tools and stories that are very inspiring that patients can access during and after treatment. We have an understanding your diagnosis tool, which helps answer questions about cancer and making various treatment decisions, as well as ACS programs and services, which provides information about services available to patients and caregivers. We have our caregivers and families, which provides information to actually assist caregivers and family members that are riding alongside patients that are going through the cancer treatment journey. And we also have cancer information in other languages. So there's linked to non-English speakers for cancer information in various languages. And so those are some of the tools and resources that ACS provides just through our website. We have a caregiver resource guide, which is a downloadable tool for patients who are caregivers or someone that's helping a person with cancer. And these include things and topics like learn how to care for yourself as a caregiver, better understand what your loved one is going through, trying to develop skills for coping and caring, and taking steps to help protect your health and well-being. And this would be listed under the cancer.org website / our caregiver guide. And again, we have our caregiver support video series, which assists caregivers in self-care, physical care training, advocacy, and we have these videos translated also into Spanish, and those are also on our website, cancer.org / caregiver videos. And again, because you guys cannot see this, I'll share this slide deck with you all, and all of these links that I'm talking about are provided in the slide deck. We also have a palliative care guide, and this guide really talks about what palliative care is, who may or should get palliative care and why, how and where is palliative care provided, how it's paid for, finding a palliative care program, questions to ask about palliative care, and also palliative care videos. And again, those links are provided in the slide deck. And I'm sure that you all have a palliative care program, so this may be of interest to you all. We also have information regarding managing treatment and side effects. We know our patients go through chemotherapy and radiation therapy oftentimes provides lots of side effects. And so we have information about these side effects and how to cope in living well during cancer treatment. We have a complementary and integrative medicine workbook, along with information on, dealing with pain, information about radiotherapy and chemotherapy and how to handle cancer pain. And this is information in booklets that organizations can request and that we can order to provide to patients. So again, the American Cancer Society provides online communities and support. And we do this through Cancer Survivors Network. This network is support for patients, survivors, and caregivers. It's a safe online community that has chat rooms and 40+ discussion boards. It helps people throughout their cancer journey, regardless of cancer type or stage. There's stories that are shared, questions that can be asked and answered. You're able to get support and share experiences with others. And members can send private messages to other members, post blogs, and more. This is free and available 24/7 through the Cancer Survivors Network community. And people affected by cancer can find help and hope from others who relate through their own experiences. And to register for an account, a patient just needs to visit csn.cancer.org. We have our Reach to Recovery program, which is one-on-one for patients. And also we provide this online support from a trained volunteer who has survived breast cancer. Volunteers are provided one-on-one support to help those facing breast cancer to cope with their diagnosis, treatment, side effects, and more. survivors or those diagnosed with breast cancer can create an online profile, and you'll be matched up with a volunteer who's experienced a similar type of breast cancer stage and treatment plan. After matching, the patient and volunteer can connect through online chats or a phone call that is convenient for them. Patients can register at reach.cancer.org, another awesome resource. We have also volunteers that speak Spanish. And so if that's a recommendation, then they can be connected with a Spanish speaker also. We have with prosthetics and hair covering offerings, the ACS care programs. This helps patients that have hair loss or gone through that. It helps women, you know, better offering types of variety of head coverings or wigs that can really help and enhance their feelings during the cancer journey. These can be purchased at www.tlcdirect.org, and there's also a 1-800 number that's in the PowerPoint that I'll provide you all with. We also have the Pink Heart Funds. It's a nonprofit about placing bulk wig orders. And just recently, we launched our Everwell, EverYou program, which also is a program that reduces costs for purchase of bulk wigs to organizations. I'm sure you guys are aware of our Road to Recovery program. This relaunched in New Mexico, specifically in the Albuquerque area. And we have now 25 drivers, which is super awesome, that are volunteers to get patients to and from their cancer-related and treatment appointments. This can be done through our 1-800 number, or a cancer patient who needs a ride can download the Road to Recovery app and request rides through the app. And so this is also like a really awesome service that we're really thrilled to offer here. The more it's used, the more we'll be able to expand. So we'd like to see this go to, you know, areas that we know have the need. So these are our rural areas, right? So the more patients that we can document that have utilized the Road to Recovery program here in New Mexico, I mean, in Albuquerque, we'll be able to expand it to Santa Fe and then hopefully Las Cruces. So really, we want this program to be talked about and presented as an option to cancer patients who are needing transportation to and from their appointments. We, of course, have our Access to Care grants, which provide grant funding both for patient transportation and patient lodging. UNM is an awardee of both of these grants. I believe there's $25,000 available in gas cards that can be offered to patients, and also through their lodging programs. We've also awarded lodging to grant dollars right there on your all's campus. It sits right next door to the Ronald McDonald House. And so that's another lodging opportunity if you need to inform patients about where they might be able to stay. So wrapping up, together, we can make a huge impact. We must now act together with you as our partners to address our current public crisis and transform cancer outcomes for the future. The American Cancer Society is excited to lead with you and your organization from across the medical and health community to address disparities and to ensure a return to cancer prevention among all of our communities nationwide. So I hope you guys have learned a little bit from this presentation. I'm sorry we had some issues with sharing PowerPoints. I'm not sure why that is. I will share the PowerPoint, and hopefully, Martha, you can get that out after we have closed, and I am open for any questions that you have.
Great. Thank you so much, Rachel. And thanks for sticking with us through the, the technical challenges. When you dropped off earlier, I know that Rebecca Emeny had a question, so we'll start with her, and then as anyone else has questions, please let us know. Go ahead, Rebecca.
Thank you, Dolores.
Great.
Rachel, thank you
Rebecca.
so much. It's great to hear about amazing things that I never knew the ACS was involved with, and really championing. So thank you for that really broad overview. I was very curious to hear that you said that ACS integrates with providers through the EMR or EHR to interact with patients or providers. I would love to know more about that. If you have examples in the state or could hook me up with resources, it would be great to learn about.
Oh, okay, awesome. Rebecca, can you follow up with me and just send me an email? I'll follow up
sure
with you
will.
directly. I'd
Great.
love that. I'd like to tell you all too that we're really excited that we actually partnered with Epic. And so we'll be rolling out for primary care providers through Epic all of our ACS resource materials that can be printed after a patient appointment. So that's another thing that's going to roll out fairly soon that we're excited about. But yes, we've
That's
worked to
incredible.
get EMRs updated. Yes, super excited.
And I mean, Epic isn't
And we can
Epic,
connect
so
on that.
every hospital has their own sort of flavor, but you have the contract with the national Epic? So it becomes like a
Yep,
package that anybody
just
can
secured.
install.
Yes.
That's great. Wonderful. Thank you so much.
Yes, really awesome. But I will talk to you and let you know how we can work to get EMRs updated as well.
Great.
Screening
Thanks
reminders.
a lot.
You're welcome.
Martha put Rachel's email address in the chat, so if anyone wants to contact Rachel directly. And in the meantime, any more questions?
Hi, Rachel. It's Isela. It's so good to see you, and
Hey, Stella.
it's always
Nice
nice
see you.
to hear what you're up to over at ACS. I was very excited about the CARES app, but I don't know if I missed if other languages are available, especially for the support groups.
I believe that there's translation services available, and Spanish for sure is available. I
Okay,
don't know about any other languages, but I know they're working on it.
All
We
right, thank you so
recently
much.
hired we have a contract with 200 interpreters. So we're really
Oh,
trying to look
wow.
at our healthcare through our health equity lens. And we know that language is one of those important,
Right.
things that we need to be looking at. So yes,
Awesome. Thank you.
you're welcome.
That's incredible. So many languages. Great. And I really appreciated the overview around New Mexico and Albuquerque. And the fact that you gave a lot of national or just, the cancer.org website like resources as well, because several folks on the call here are actually in Arizona because our network is across the Southwest. So that's great too.
Wonderful.
And let's see, any other questions?
Yeah, I have one. Thanks, Dolores. Hi, Rachel. Thank you so much for your presentation. I'm Kristen Goslink. I'm at the Burrell College of Osteopathic Medicine, and I've been working on a project for a few years now with UT El Paso, just down the road from us, and on HPV and HPV vaccination. I really appreciated the provider education for healthcare providers resource. I guess my question is for those CME modules. The 6 self-paced sessions, do you have to take them all at once, or can you spread them out? And do you have to complete them all in one sitting?
You don't have to take them all at once. You can spread them out. And I would love it if you would email me, Kristen, because I can connect you with my local ACS rep that is actually working with hospitals in El Paso.
Mm-hmm.
Number one. And number two, we can get you the HPV posters, which I think you'll love and find helpful.
Yeah, that would be great.
Support that. Yeah, to support that effort. And
Thank
you can work locally and you'll be able to get those HPV webinars sent to you because you'll be on that local mailer list.
Yeah, thank you. We do work with the local ACS representative there.
wonderful.
As part of our Cuidate El Paso program with Eva Moya, and I'm completely blanking on the doctor at Texas Tech who's part of this. But one thing I just wanted to say for the group, because we've been focusing on the provider angle on this, it's really interesting because there are a number of published articles that talk about the importance of provider recommendation in HPV vaccine uptake. And yet in our local survey, we surveyed current and emerging providers, so in training and in practice. And we asked them about their perceived barriers to vaccine uptake, and they all ranked provider recommendation the lowest priority. So that was interesting, and I think a really interesting place for intervention maybe.
Yes, and we have HPV, EBI, early intervention based work going on right now. And we actually have a cohort. And so when we recruit for that, it would be great to have information because all of those organizations learn from each other.
Yeah. Thank you so much.
You're welcome.
Okay, great.
Thank you for the
And-
awesome question, guys.
Yeah. Wonderful. Thank you again so much, Rachel. I'm going to pop my last slide up here just to give a plug for the upcoming webinars that we have. So you'll notice they're October 23rd, November 20th, December 18th with our different topics. These are all in Mountain Standard Time, which Arizona joins us again, I think, in early November. So this will be the same time for you all. But anyway, looking forward to those. And be on the lookout for an email with the evaluation link. Like I said at the beginning, these evaluations really help us with our planning, as well as understanding how things are being understood and received. And I think, yes, and then Martha also put the evaluation link in the chat itself. So you're welcome to just click on that right now and just do it. It's just a couple of minutes. And like I said, really helps us out. So that is it for us this month. Again, thank you so much, Rachel. This was really wonderful. And I learned a lot and took some really good notes. And I'm looking forward to talking about it with our group here too more.
Oh, that's so great. Thank you
Yeah.
guys so much for inviting me. I look forward to working with you all.
Thank you. Thanks, everybody. Have a great day.
Bye. Have a great
Bye.
week.